Hi everyone, my name is Marcy Tucker and I'm a clinical marketing specialist here at CIVCO and a sonographer with over 20 years of experience. Today I'm going to show you our 100% gel-free Envision Pad, and I will demonstrate how to use it using an aseptic technique. When you open your sterile package, you will find an Envision Pad, a sterile Envision Pad, and a sterile saline wipe. The Envision Pad on the inside is made with a very gentle silicone adhesive and has been validated by most ultrasound manufacturers not to damage your transducer. The outside of the pad is a hydrophilic coating that is activated with liquid. So that is what you'll use your sterile saline wipe for. If the sterile saline wipe is not available or becomes contaminated, you can use just a syringe of saline. You will pick up your Envision Pad off your aseptic field, peel the liner. If your transducer is in a transducer holder, you can take your Envision Pad and apply it onto the transducer in the holder. If you don't have a transducer holder, you can simply take your transducer, place it in the middle of the silicone adhesive, and just wrap the pad around the transducer. Next, you'll want your sterile saline wipe. There is a lot of saline in this wipe and in this package, so you can use the saline wipe multiple times, and you can wet the pad as many times as needed. I would also wet my patient at the area of interest where you're scanning. I also want to recommend that if you do a pre-scan, before you apply your Envision Pad, that you will want to make sure that you completely wipe the gel off your transducer before applying the pad.